Hi, I'm Sarah Wheaton, Politico's senior health reporter, and welcome to our event on Europe's Beating Cancer Plan, where we're going to try to figure out what success looks like. I'm sitting here from a big empty room in the Residence Palace here in Brussels, and I'm just thinking back to almost exactly 7 months ago where I was sitting in a big, very full room, the plenary room of the European Parliament, where we were launching the consultation of Europe's Beating Cancer Plan. There was a chorus. I think there were two choruses, actually. There were speeches by Commission President Ursula von der Leyen, by other commissioners, members of Parliament. It was a big extravaganza to celebrate the launch of this big effort to beat cancer. But one question 7 months later still is in my head today. Where do we get past the politics and actually take action? And over the course of the past 7 months, we've seen surveys just out yesterday from the World Health Organization showing that 90% of countries saw their health systems disrupted. With regards to cancer specifically, we've had many stories of delayed diagnoses. From personal experience, I had a friend who is now facing more serious cancer than he would have if his diagnosis had happened on time, if not for COVID. And so we know the urgency. If it was urgent 7 months ago, Europe's Beating Cancer Plan is even more urgent now. So I'd like to thank our sponsor, Bayer, for making this virtual event possible. And I'd like to thank all of you for joining me here today, for celebrating the rentrée with us here. And I'd like to encourage you to ask questions using our Slido, using our Slido poll. So that's sli.do and using the hashtag BeatingCancerEU. So go to slido.com, that's sli.do.com from your computer or phone, and use that hashtag BeatingCancerEU to ask your questions, and we're going to do a test poll. So, in your opinion, is Europe's Beating Cancer Plan, is it set to make great strides in Europe's fight against cancer? It will allow for some progress, but it'll be mainly up to member states to make a difference, or is it mostly political communication? So I'll give you a few minutes to test it out. Well, the three people who have responded so far are taking the middle road. All right, we've got some more people. All right. The pessimists are coming in late. Anyway, so that's a chance to test out the program, the Slido program. And we do actually already have some questions on Slido. So reminder to put those in, and I am much more likely to actually ask your question to our panelists if you include your name and something about your affiliation. So without further ado, I will turn the floor over to Stefan Ulrich, who is a member of the Board of Management, head of the Pharmaceuticals Division for Bayer AG. Stefan.
Well, thank you, Sarah, and welcome everyone to this important session. I think, as you alluded to, COVID-19 has really upended our ongoing efforts in addressing the pressing needs in public health in our mid to long-term strategies with regard to all health systems, and that, of course, includes also cancer. I think there have been, however, quite an important series of learnings that we can draw from the pandemic. Of course, we're still in the middle of it, but I think as we learn to live with this, we can draw some first conclusions. The first thing that, to me, I've witnessed in my job, but also beyond that, is that the idea of my country first, or even my company first, really does not work in this very wide-reaching pandemic. I believe that only true multilateral collaborations across the private sector, but also the public sector, policymaking, and academia can really sustainably shape our responses to fighting the pandemic. And what we've seen in our business, for example, that closing borders was mostly a political instrument, While from an economical standpoint and from a private sector standpoint, there was no need to do that to continue to supply to the need of patients around the world. And we've seen some shortages more out of political necessity than really out of economic necessity. Second thing is what I like to call health for all. I mean, it goes without saying that patients are front and center of our deliberations, and COVID-19 continues to have an incredible knock-on effect on other disease treatments. What we've seen, and cancer is a wonderful example, is that because certain treatments were deprioritized, and also patients would be afraid to go and see physicians, that we saw a decrease in use of physician resource, but also of medical and medicines in very life-saving indications. We've seen people that would cure heart attacks at home. We've seen also postponement of cancer treatments. I've seen this in many regions of the world, and you could really see it, especially in the second quarter of this year, in our sales numbers that were impacted by that. Now, while COVID-19 has left some severe scars in our health system and in society at large, we also need to continue to address the ongoing challenges in the chronic diseases space and support really continuous diagnosis and treatment, as innovation in cancer care needs to be really catalyzed by continued investment. We believe that the mid and long-term economic impact of the pandemic, of course, needs to be still seen. But in between, or as we wait for the end of this, we also need to take an active role in keeping the Beating Cancer Plan on the radar screen of all policymakers. Cancer remains the second leading cause of mortality in Europe. And let me also remind you that in our overall investments into health, we only spend 1% of the health budget on cancer medicines. Meanwhile, there are, of course, important strides that are being taken in precision oncology. Through a more targeted and personalized approach, there is a strong aspiration for better outcomes and reduced cost for ineffective treatment for the individual patients. And in the aftermath of the pandemic, all contributors in cancer care in Europe need to join forces to intensify cancer screening programs in Europe. This as part of an ongoing effort in precision oncology, of course, and also to ensure that cancer care becomes resistant to pandemics in the future. Screening, diagnosis, and consultation remain integral in holistic cancer management and need to be steadily anchored in the health agenda in Europe today and in the future. The European institutions can and really should play a decisive role in increasing care outcomes with pan-European initiatives, and also they should be harmonizing deviating standards in prevention, treatment, and care. Just a number here, 73% of survival gains in cancer can be attributed to innovative medicines. Thanks to pharmaceutical research, many cancers are chronic diseases now. Cancer research is necessary to find new treatments with a curative intent. Therefore, I really believe the EU should strive to achieve harmonized care outcomes across its 27 member states. We at Bayer do support an update of the 2003 screening recommendations, supplemented by a new European recommendation on genomic tumor testing. Only early testing and diagnosis can help provide better and timely treatment of cancer patients. So we work tirelessly to advance programs in science and innovation with a view on cancer treatments. The required policy framework will ensure that the member states act in sync with medical progress and seamlessly integrate new science into health systems, of course, always and solely for the benefit of patients. So those are a few of my thoughts. I thank you for listening to me and hand back to you and wish you all a very good conference. Thank you.
Thank you, Stefan. And now I'll kick off our conversation with our panelists. And as I said, I'm sitting here in this empty room because a lot of people are not feeling safe coming back to Brussels. In fact, for people coming from Germany, it's actually considered a red zone. And so, as we were just talking about with Dr. Peter Liese, who is an MEP from Germany, from the European People's Party, and also a medical doctor, you have been, Dr. Liese, working a bit on the front lines, trying to help deal with this crisis. Is this really the time for us to be switching back to the regular agenda, including cancer? Do we need to keep focusing on COVID for a little bit longer, actually?
Now, in fact, we need to do both. Cancer is one of the main killers of human beings, and we were forced to accommodate a little bit work in the last months, but we need to be able to address both of the challenge. And I think it is not fair to somehow have a priority only on COVID or only on other diseases, because specific measures are necessary to help patients and to prevent diseases. With COVID-19, the point is that even though we are all suffering from the measures, we have measures in our hands that could, in theory, avoid all the diseases. When we keep a distance or wear masks, we can avoid every infection. And it's only spreading again around Europe because some people obviously don't care. They do parties, and that's putting people at risk. And what I think is it's really important, it is not, as some people say, only the elderly that are at risk. It's also, for example, cancer patients that have, due to their treatment, immune suppression. So I think this is very important to protect these people. But at the same time, we need to address cancer more than we did in the past. And we had some problems in the organization of the parliament, and also the commission had a lot of challenges. But it's now the time to come back to our agenda after this huge conference in February. And we are determined in the European Parliament. A special committee on cancer will be established. We will know who is the chairman. It will be an EPP colleague, and she will have a professional background in medicine. And we will have the first meeting this month. So we will go ahead, and the Commission is also determined to go ahead. And there's one thing which we need to deal immediately to address both threats, the COVID-19 crisis and the huge challenge of cancer. That is, we need to guarantee enough money for research and technology. The Horizon program is underfunded when we look at the challenges, and I'm really angry with the Council, with the EU summit, that cut the Horizon compared to the Commission proposal and the Parliament's position dramatically. The negotiations are ongoing, and if we don't invest in research, we will not deal with the challenge of cancer, and we will not deal with the COVID-19 crisis and future pandemics, whenever they will appear.
Thank you. And you touched on several points that we're definitely going to be talking about more throughout this, including research funding and the latest that's happening in the Parliament. But for now, let's take a look at the Commission. John Ryan, you are the Director for Public Health, Country Knowledge, Crisis Management within DG Sante. Big job. You are overseeing the cancer plan, as well as things like the Health Security Committee meetings among member states talking about the response to coronavirus. How have you and your team at the Commission been able to balance these competing demands?
Yes, so we actually, just to answer your question briefly, we allocated a specific team to prepare the Europe Against Cancer, Europe Fighting Cancer plan. And this team was protected right through the whole process of coronavirus in the last few months to work exclusively on that topic. So basically, from the point of view of preparing the Europe cancer plan, we are on schedule, we are on time. The delays have occurred, as Peter said, because of institutional issues around the meetings of the Commission itself, but also the meetings of the Council and Parliament. We're now in a stage where people are getting more and more used to virtual meetings, and therefore it's been possible for us to launch several of these meetings virtually using the web. And I've mentioned in particular the meetings we've organized with stakeholders on different aspects, including on coronavirus and cancer, which we've organized through the web, and that's enabled us to keep going on that front. The schedule at the moment is that this cancer plan is on the agenda of the health ministers on the 2nd of December. So basically everything will have to be wrapped up before then, including, by the way, the necessary contacts with the European Parliament, and that's going to be a challenge, I think.
Yeah, so quite a sped up timeline towards the end there. Matty, what have you been seeing as far as cancer treatment and the pandemic? Do you have a sense of what some of the kind of long-term effects will be, and how should the people thinking about the cancer plan be incorporating some of what we've seen during this period?
Well, Sarah, I think that we have already heard quite important comments about this fact. We should not be here beating ourselves because we did something wrong, as we had to face such an unexpected virus as COVID-19. We have to learn from this. And the one point that I believe we should have learned is that as we reacted a long time ago to the pandemic of the so-called Spanish flu, we are going to react to this. But there is a need for cooperation. There's a need for good communication. And Peter addressed one very important point, which is was already alluded to by Stefan, that in our communication towards citizens and patients, we didn't emphasize that our health system was still, besides the COVID crisis, able to cope with what was needed. And unfortunately, not only in cancer, but in other diseases like cardiovascular diseases, many people were treated too late because our communication was such that they were afraid to go to see the doctor, they were afraid to go to the emergency room, which had been prepared to face these issues. So we have a lot to do and to learn, and we should now move forward. What we have learned is something that will, in my eyes and the eyes of the European Cancer Organization, show to all European governments that health has no limits. Health is universal. Health is in Europe. It's not a national prerogative. And we have to find a way of working together and looking at what is the best choice for citizens, looking at ways to diminish the inequalities that exist within Europe and within countries themselves about health. And the Beating Cancer Plan has a very clear, very nice way of looking forward to the prevention, to the early detection, the treatment and care, and to the quality of life of the patients. I'll stop here my initial intervention.
Thanks very much. And Matt, that was Matti Abro, the president of the European Cancer Organization. And I'll turn now to Bettina Rill, who's the founder of the Melanoma Patient Network Europe. And you're also a member of the Cancer Mission Board for Horizon Europe. So thinking of how to spend some money, although perhaps a bit less, and we'll get to that in a second. But first, a more thematic question. This we've talked about a lot of the problems for cancer patients that have emerged during this period, but are there perhaps some changes in public perception that may actually help move the broader agenda forward?
Well, I think the first worry, and this has already been alluded to by previous speakers, is that some cancer patients at least are already at a higher risk, basically just by simply contracting COVID, because they might have a suppressed immune system, and that is very much dependent on, for example, the therapies that are used in a given cancer. But something that really, really worried us was when the crisis started back in March in most countries in Europe, many healthcare systems started rationing care and started especially rationing access to intensive care beds. And wherever you looked as a cancer patient, even if you were like stable, surviving, you were always on the last. So we knew that if our people, even if they were fine and currently surviving, and I'm in melanoma, where we now have these long-term survivors, where we don't know how long they will really survive because the drugs are so new, we knew that they would never have a chance to enter the system. So all of a sudden, these people who have already been struck felt not just threatened by disease like everyone else, but also abandoned by their healthcare system. And I think that's something we really have to address in the future. It cannot be that we invest a lot to treat cancer and then abandon them when the system comes to it. So I think that was one of the first lessons. Afterwards, we were mainly worried about the treatment of advanced cancer. So, however, that actually turned out not to be true, because in most places, countries put structures and procedures in place to continue care of those most in need. And that went for us, well, it sounds funny, but surprisingly well, even to a degree where some of our patients reported that they received better care than under normal circumstances. The classic one, if you have a new therapy, what we have immune therapies. The side effects are something that many of the physicians have never seen. So by training, I'm also a physician. This is something we were not taught at medical school because these therapies are so new, they behave differently. So a classic one is a patient has a side effect, ends up in a local hospital, they have never seen these therapies, and the patient is not adequately treated. That happens to us all the time. Now, under COVID, what hospitals invented were separate streams for oncology patients just to keep them out of, well, to lower the risk for them contracting COVID. And it has actually led to an improvement of care. So that is obviously something that I hope we will be able to take forward in an improvement of our healthcare systems. That would be one thing. Something that we have been arguing for and that we have seen across the cancer communities, and that has been alluded to by previous speakers, is the inequality across Europe and the need for collaboration. And I think COVID has clearly demonstrated the power and the potential of what you can achieve if you work together. And I do hope that we remember some of that and that we can translate this also into other conditions. Because if you really think about it, it makes no sense that we apply it to one condition, but not to the other. It makes no, intellectually, it's not, you cannot even trace why. Okay, I understand that everyone feels threatened and all of a sudden we collaborate. But if you look at the numbers, how many Europeans are dying every year of cancer, it is something that should be very high on everyone's priority list. It touches 1 in 3. So if it's not you, it's going to be someone very close to you. So it's something we all have to take more seriously. And that's my hope.
Thanks, Bettina. And sticking with you, something Dr. Lisa referred to and said he was quite angry about, and something that we also have a question on Slido about from Jens Jaeger. With the risk of a reduced research budget under Horizon Europe, how can the cancer plan still be successful? Is this something the mission board is grappling with?
Well, I think we're all grappling with that. So first thing is it's something that, if something has shown us under COVID now what helps us get out of this mess, then it is research. And what do we do next? We cut the research budget. So that's one of these things that I call biting the nose off despite the face. So that is something, I think it is a reflex. We are under pressure. We have lots of direct costs. So we cut our future in order for very, very short-term goals. That's one side I see on it. At the other time, it is also, I mean, it's called discounting, right? We always value something that's closer to us now than some potential future benefit. This is why you smoke today and get the lung cancer tomorrow, or many other behaviors that work along the same lines. You save, you might not save because the pension is something you're going to worry about in a few years. So it's normal human behavior. And from that, they just kind of, I mean, the people who took that decision just behave like ordinary, humans. If you want to read about behavioral economics, that's the reason to the direction to go. On the other hand, I also think that we have improvement in the way how we conduct research. Someone way smarter than me has said the definition of insanity is doing more of the same and expect different results. I've worked a couple of years in research and I know how the system works. And there are also redundancies and there are really perverse incentives in the system that I believe prevent us from making the progress we could be making if we did it differently. And COVID has has delivered us the proof of that. If you look at the speed with which research progressed, the degree of collaboration, of publication that we see now, we never see in normal times. And why is that? If you look at the incentives in the system, they are not meant to deliver direct results as fast as possible because you might need the publication. So you are better off as a researcher to deal in what I call SPUs, smallest publishable units. As I said, I worked at university a couple of years. So if we're serious about cancer, I think we actually have to tackle that as well. And there are some fantastic initiatives already ongoing also at the European level. I just read recently something on a new type of funding called cascade funding that is used to incentivize tech development, for example. Maybe we should be thinking to motivate also funding in our areas in different ways. Give out smaller grants initially, select and then fund larger. So I think we have to rethink the system, it's not a matter of just throwing money on it. And I mean this not in order to, sugarcoat a lack of funding, which I still think is the wrong decision to make. Ideally, in my ideal world, we would have both sufficient funding and rethink the way how we do research.
Do you see this cascade funding becoming part of the mission?
Well, I hope so. I mean, I'm definitely going to suggest it and see what my board colleagues say. So I was very fortunate that I got approached by, these coincidences in life. And I actually think that this is something that we should foster in research. It's like a certain degree of serendipity. So I was also on a webinar talking about the cancer mission, and then it turned out there was someone from the ESRF, which is a European institution, and it's a particle accelerator in Grenoble, where I used to spend some time as a postdoc on a totally different matter. And we were scanning fossils, just like for you two, So super cool, very, very different, not medical. But it turns out they actually have a medical facility. And then you start talking about it, and then you start thinking about how these European collaborative projects can actually kickstart research that no one else can do, that is unique, where we have something that only we can do. And they are actually quite advanced, and they are actually implementing this cascade funding in an extra project, which is also European funded. It's also a Horizon 2020 project. So it really got me thinking and reading up on it. And I do believe, or I do hope, because we're going to hand over our recommendations to the European Commission during Science Days very soon. So I strongly hope that the European Commission will rethink that and will take this up and hopefully, come up with something and putting pieces together and also work on that angle. It's not just the what, it's also the how we do research.
Mm-hmm. And Dr. Lisa, you said you were angry about these funding decisions. Is Parliament actually going to be able to do anything about it? What's the game plan?
Yeah, the negotiation just started last week. The Parliament, as you may know, in July we had a special meeting after the European Summit, and we said we are not ready to support this deal. And without the agreement of the European Parliament, there will be no MFF. And that's why we need to discuss, we need to negotiate. We also want to increase the budget for EU for health. So there was also a decrease compared to what the European Commission proposed. And this is another priority. But when we see the figures, Horizon is of course much bigger. And here we are already very concrete. You mentioned the cancer mission. It was a very important priority of my political group. Christian Ehler pushed for it, and we need to have enough money now for the cancer mission. It's right, we need to focus on also what we finance, we can improve it. But when you compare the amount of money that the United States spent for cancer and the amount that Europe spends, we need to do better. And there are issues which cannot be addressed by the member states. You know, for example, pediatric cancer. You don't have the figures to do a good clinical trial when you do it only at national level. And we heard from Bayer for the personalized medicine. This also requires cross-border clinical trials, cross-border research, and not everything can be done by industry. You know, industry has a responsibility, but when there are ideas that are not beneficial, where there is no business case, it's also public money that needs to go in. So for me, the health program is important, and we are fighting for an increase. We have an increase compared to what was in the past, but we all understand that health is a much more European issue now than we knew it 1 year ago. Parliament was always arguing for more activity of the European level, but now also ministers have understood. But research is maybe even more important because we have very concrete ideas how we can help. And that's what I meant with the comparison of COVID-19 and cancer. COVID-19 can be completely avoided if we keep a distance and on top of that use mask when we can't keep a distance. In cancer, 50% of the cases we don't really know. So we know that tobacco has a role to play. We know that obesity has a role to play, and some other issues. From that what we know, also chemicals have a role, but very small compared to tobacco. But 50% of the cases, according to WHO, we don't really know. So we also need the research to understand the cause of the disease so that prevention is even possible. And for 100% of the patients, if we know the cause or not, treatment is important. And that's why I emphasize so much this importance of European research.
And so would you say that research funding, Horizon funding, is a red line as far as the budget, or can it be traded for something else that gets an increase?
No, for me, it is the most important point in the whole MFF, and it's clearly a priority of the whole Parliament. I cannot imagine that we agree to an MFF when the amount for Horizon is not increased.
Thank you. And Matti, I know you want to weigh in, but first I'm gonna ask John. A lot has changed, as we said, since the kind of initial outline of the cancer plan was released. The budget has gone way up and then down a bit again, but still higher than when kind of the initial proposal was made for the consultation. Obviously, COVID has happened, and then, as you said, you have been engaging in many conversations with stakeholders around the continent. And so, have there been any big changes to the vision of the cancer plan since February?
Yeah, so a couple of points I'd like to make, perhaps just to situate where we're thinking and to react to some of the comments so far. First of all, I want to emphasize that the Commission made a decision was made then by the European Council in a different direction. And of course, as Peter said, the discussions are still ongoing on that. But we are trying to make our proposals on cancer in particular fit the available budget. So this is an ongoing process. I don't think we have the final position so far. One point on the R&D budget, which I'd like to emphasize, is that the cancer mission is not the only spending on cancer research within that budget. There are many envelopes within the R&D budget which could be used to contribute to either the prevention or treatment of cancer. In addition, I would just like to make the point that going back and looking 30 years backwards, when the first Europe Against Cancer program was adopted, one of the lessons from that program is that the real gold standard at European Union level is not just spending money, but also using our treaty powers and the legislation to change the situation on the ground. And we have some practical experience which can be proven on how the situation has moved since the original Europe Against Cancer plan. A good example of that would be the tobacco legislation. There was no tobacco legislation before the Europe Against Cancer plan. And you can see now the huge change in population behavior in terms of consumption of tobacco products, the acceptability of smoking, and the acceptability of passive smoking as well, by the way, or the non-acceptability of passive smoking. So you can see that just taking that one example, and I'm not going to repeat the number of examples, but you can see that using legislation as a tool, as a lever, can also play a major role in prevention. And not alone that, but the third point I wanted to make is that we're talking here about funds coming from the European Union budget. In my experience, the problem is also not just the available money at the European Union level, but also the capacity of member states to absorb that money and to absorb it efficiently. Now, this varies according to the type of European action you're talking about. If you're talking about a research joint action or a research initiative, I don't think the problem is really so acute. But if you're talking about a European investment which requires a matching investment at national level in the health systems, then you do have ceilings in some of our member states, and not in the usual suspects. Also in the bigger member states, they do have problems in making sure that they have the matching funds or the matching staff sometimes to absorb money. So I think it's important we look at this in a 7-year perspective with a 7-year European Union budget. I think that's an advantage which we have. So we're not talking about spending everything in the first year, but we can give member states time to have different phases of a project. In other words, a startup phase, an implementation phase, and a phase where it becomes a permanent part of the member states' health system.
Thanks, John. And Matti, I know that you wanted to weigh in on the research question. So if you could reflect on that and how the actual, does it necessarily make a difference what the sum is, or is it more kind of the political message that's being sent from the mission, which was also kind of one of the aspirations of having these 5 very concrete areas for Horizon Europe. And also, if I could tack onto that, what John was just saying about this point that this is a 7-year plan, and how does the fact that it's a 7-year plan how would you advise European policymakers, either in Brussels or in the capitals, to kind of take advantage of that longer runway?
Well, thank you. From my personal perspective, I've been sitting in what is called the Assembly of the Cancer Mission. So I've been able to interact with the Cancer Mission and see how it has progressed. And there is a really remarkable project that is being put forward. I do understand that we need money, but we also need coordination, cooperation. There's a lot that can be done with the money already available. And I'll just go to facts that were put forward by the OECD not that long ago, that there's a huge waste in our health system of money being used in the wrong way. And this was in some ways alluded to by Bettina. So I think that we can do a lot with what we already have if we work better together. And for example, we also have mechanisms in place that exist that just need to be emphasized and put forward. It was mentioned that in some disease types, we need a real European cooperation because we won't have in every single country the needed amount of patients to really have a reliable result on what is the right way to prevent or to treat or to keep the quality of life of the patient after the treatment and during the treatment. And so we do have, for example, the European Organization for Research and Treatment of Cancer that has been working for a long time. And this is one mechanism that we don't need to reinvent. We have it there. So then let's not be reinventing the wheel, but let's look at what is available. And the Beat Cancer Plan has several areas where a cooperation between states which have plans could deliver a lot for the whole of Europe with just some better organization there. And we have fantastic initiatives going on. The new European pharmaceutical strategy is a very important one. And then we have to think of the workforce. And the professional qualification directive is extremely important, for example, for the training and the possibility of our nurses to go from one country to the other and be recognized as specialized cancer nurses. So there's a lot that can be done, and was alluded to earlier, by politics and by legislation, not only by the money. Of course, the money is needed, and Europe has to invest a lot more.
Thank you. And we have a lot of great questions, so I'm gonna start with some of those. So one from Michael Landl from the World Vapors Alliance. It says less harmful alternatives compared to smoking, for example, vaping, could save numerous lives. What role will the concept of harm reduction play in the Europe Speeding Cancer Plan? John, you talked about changes in culture around tobacco. Will there be anything about vaping or harm reduction in the plan? I think we have an audio issue for you, actually.
Yeah, can you hear me?
Now we can, yes, thank you.
So there is a challenge, and we're trying to develop with our colleagues across the Commission different initiatives relating to prevention. I don't want to go into making commitments now on vaping in particular, but tobacco will be there, and a reinforcement of our measures on tobacco will also be part of that. Peter was talking earlier on about the capacity to improve our performance on prevention. Given that, about half of cancers, we don't know what the link is with causal factors. So we do know that tobacco is a causal factor for cancer and for many other diseases. And therefore, I think we would be justified to include tobacco and smoking prevention as part of the prevention chapter of what we're coming up with.
And quickly, we also have I'll definitely pull others in, but we also have a similar question about alcohol. In 2016, the main cause of alcohol attributable deaths was cancer, according to the European Alcohol Policy Alliance. Will the EU be ambitious in its actions and introduce alcohol-specific legislation? So, John, just quickly, even if you want to just give a yes or no, that's fine. And then, Dr. Lisa, I'll kick it over to you.
Well, I'm not going to read out the action plan to you today because it's still
if you want to do that, we have as much time as you need.
Exactly. No, alcohol will be there in one form or another. It's already there, by the way, in the Europe Against Cancer Code, where there are quite strong recommendations and science-based recommendations on alcohol and tobacco, among other things. So we will have a chapter on prevention, and all of the determinants of health and of cancer will be included in that package.
All right. I'm going to go ahead. I assume that this panel is supportive of that. So forgive me if I go ahead and skip to the next question. So first, one from Emma Woodford from EONS. How will specialist training and skills for cancer workforce be ensured across all member states to iron out inequalities in access and quality to cancer care? Matti, can you weigh in on that one first, please?
Well, Emma is coming with a question to which I alluded to earlier about the fact that we have the Professional Qualifications Directive that is being built. Will this be really the answer to the very, very important point of the exchange of professionals between European countries, recognition of the diplomas, and also the specificity of the European oncology nurses, which is an area recognized in some countries, absolutely not recognized in others? That is something that I cannot say at this point in time, but certainly the European Cancer Organization is trying to make a voice through all its members to have a good implementation of a directive that should really allow recognition of those that have played such an important role in cancer treatment. And I believe everyone has recognized the crucial role of the nurses during this dramatic COVID crisis.
Thanks. And John, if you could weigh in, is this particular element of training in terms of tackling inequalities part of the plan as it's working out now? And then also more broadly, I'm going to incorporate another question from Tillman Kruger from MSD, who noted in light of the results of our first poll, which showed most people think that this is going to have to really depend on the member states, how can activities under your Speeding Cancer Plan be connected with cancer plans in the member states?
I'll start with the second question first, maybe, and just to illustrate my point. During the health program activities, which have just concluded, we have actually been supporting the member states in developing national cancer action plans. This was done really hands-on by the member states themselves, but with support from the European Union level. And I think this has shown that with the right seed funding at the right planning level, health ministries can engage in areas like cancer, but also that's one example. We have other areas of public health where member states have also come together. The idea is not to have a multiplication of national plans on this and national plans on that, because one of the complaints very often that we hear from the NGO stakeholder community is that you end up with a multiplication of beautiful plans and nice photograph opportunities, but then the resources are not there at the national level. So going back to the point I made before, it's important that the allocation of resources is clearly identified when you're making these planning documents. So in terms of what will be in the Europe Against Cancer plan in relation to workforce, we envisage, for example, mobility programs for researchers and practitioners in oncology, but also interdisciplinary cancer care training and educational programs, which will be more centralized but then made available. Because you've got to realize that, of course, the picture on the ground in the different member states in relation to the available resources and capacities for prevention and treatment of cancer is completely different. And therefore, to reduce inequalities between the member states, first of all, having a recognition that cancer is an issue, having a national cancer plan, identifying resources, making sure you have the necessary trained personnel either through local initiatives or through mobility or through central training programs is something which we'd like to encourage in the cancer plan. And a specific action which I'd like to mention is in relation to radionuclear medicine and radiology, where the European Union has a very strong track record and history, including a legislative one. And our colleagues who are responsible for radionuclear medicine in the Commission are also working to have a complementary quality control process there to reinforce what's already on paper by rolling out training and quality control activities. So those are just a couple of examples, but it is really an area where we're very concerned about, in addition to the general problems of resources, the staff resources around the European Union, because of increasing demand, aging population, and so on.
Bettina.
So also in the mission, there's actually a recommendation that focuses on education and already touching on the points brought up, an exchange between different centers. And if you remember how, for example, Horizon programs are structured, you always need multinational consortia, and there's very strong focus on building capacity also outside the traditional areas. I personally think that we should support this and encourage this. I do a lot of education, so we train across Europe and we train across language barriers. And I do believe that, well, it's always easy to have to demand one solution for everyone in Europe. But if you then really think about how our countries look like and how we act and how we operate, you see that we have very strong cultural roots. It's not just the language, it's also how our systems are organized. And I think one has to find a little bit like a good balance between the two. So I can only stress what has already been said, that from a European level, we should be thinking, how can we support countries to build something that is fit for purpose in their own system? Because in the end, a patient is seen in a local hospital. So it has to be something that works in the setting that we find actually in that place. And I personally think that that's the real challenge, because you have to find kind of, if you want, I think of it as like the information currency, something you can pass on, an element that the other side finds helpful and doesn't feel like I'm telling you what to do. Well, that never works anyway. But it's kind of thinking how we can identify the pieces where we have to work together, and what is country specific in getting the balance right while connecting across. So I think that is what makes Europe so special and what makes it also challenging, while at the same time, I think I'm a positive person, so I'm always looking for that silver lining. If you look at Europe, you could also look at it as a system of parallel innovation. So instead of looking at duplication and complaining that there is not one magic fix, I think we should start looking more at, okay, so different countries come up with different solutions. What can we pick up from that? What works well? Can we learn from it? Is there an underlying thread? Are there specificities? If this works in this country, maybe a country that is similar in other respects. So I live now in Sweden. If it works in one Nordic country, maybe it works in the other Nordic countries. There are other countries that have similarities. So I think we have to rethink a little bit the learning for to increase the efficacy of the training we're providing. Because if you look at it, there is already quite a bit of amazing resources out. So I've been involved in the European Society for Medical Oncology. I've been responsible for the patient advocacy track. I've worked together with the young oncology community, and they provide fantastic training. And the only thing you have to do is you have to show up and learn. So I think we should encourage that learning process on top of everything. One can always demand, one can always ask.
Thank you, Bettina. And so we're way over time as it is, but I want to ask the most popular question on Slido, and then I want to reserve my right as the moderator to ask one more question of my own. So we'll try to keep these answers very short. But our most popular question from SIOP Europe is, can you share how the Beating Cancer Plan intends to address childhood cancer? Bettina, is the mission, there was briefly talk that the mission was actually going to be specifically childhood cancer, got broadened out to everybody cancer, but is the mission going to look at pediatric cancer specifically? Of course. So we have a specific recommendation, but we're also discussing, because in the end, many of the aspects of childhood cancer, many of the aspects we're talking about also address childhood cancer, and often a very specific set. We have already said earlier on that especially childhood cancer is one of these rare cancers, thankfully, but it requires collaboration, because every country, especially smaller countries, might not have the resources and the knowledge. So collaboration is essential, and having access to care. So if your country does not have the resources, a child should be treated somewhere else, and in a package that takes care of the entire journey, if you want, and the family around it. So I do think that this is something we have to really rethink. And as adult cancer, I do think there's a lot we can learn from the pediatric cancer community, because they seem to be that edge more collaborative and that better organized. If you look at the numbers of children or with cancer who go into clinical trials, that's way above
what happens to adults. So I think that can teach us a lot. So yes, it will be addressed. I think it's never enough, and something I care about also because I have friends who are long-term survivors of childhood cancer, thankfully. The long-term consequences, if you have cancer as a child, you have many years to live, hopefully. So what happens in that time is critical, and I believe we have to do better to anticipate what happens to these children later on. So yes, it's a topic. I know it's also in the Beating Cancer Plan. So yes,
Thanks,
it's coming.
John. Yeah, thank you, Bettina. John, hopefully your audio is working now.
Hopefully you can hear me now.
Yes.
So I just like to mention that we do have existing European reference networks linking hospitals around Europe with expertise in different types of cancer, including rare cancers and including pediatric cancers. So we intend to maintain and expand those networks. Secondly, there's a revision which is planned of the orphan and pediatric medicines regulation, where I think this will also provide us an opportunity to do something specific on childhood cancer. Thirdly, we're looking into issues around work-life balance, and particularly where parents have to take special leave, for example, to take care of sick children. That could also have an impact on quality of life for children suffering cancer. And of course, the last point, I think, is probably the most significant, but the most difficult to get our heads around, which is the right to be forgotten. And we've seen national initiatives on the right to be forgotten. I think this is particularly significant for young people's cancers when they have a whole life to lead, then trailing this medical dossier behind them.
Thank you. And Matti, is there a particular area on pediatric cancers where you feel like Brussels could really have a big impact?
I think that Brussels can have a big impact not only in pediatric cancers, but also in all cancers. And of course, one of my areas of interest is geriatric oncology. And it was alluded to that we have an aging population. So while we have a huge amount of work still to be done in the pediatric area, where a lot of progress has been done, and Bettina said it very clearly, we need to look also at other areas. And I would like just to come back to one point that was alluded to at the beginning, actually, was that everything we are doing, we are looking at patients, and Bettina is here to in some ways represent them. And one of the initiatives that we have put forward, the European Cancer Organization, is what we call the European Code of Cancer Practice, which will have 10 overarching points that we want to discuss on the 23rd of September. And we already discussed this with Stella Kyriakides, with the commissioner, and she has been endorsing these points with all her heart. And as you know, she has been working with us at the European Cancer Organization a long time ago. So this is a point that I really wanted to make. And of course, pediatric cancers, let me repeat this again, are important, but all cancers are important.
Thank you for that. And my last question, the overarching theme of this is, what does success look like? John, you talked about looking back 30 years. If we're 30 years from now, if we're looking back, what do you want people to say? Oh yeah, that when they passed the Europe's Beating Cancer Plan, this was really the sea change. Bettina, I'll let you start with that one.
Well, you know that it's something I'm really, really passionate about. And so as you know, right now we have the Beating Cancer Plan and the mission in parallel. And one is on the health side and one is on the research side. And someone actually called it like the stars aligning. And I believe that that is so true, and in an area that where I've seen a big problem so far is we have looked at cancer from the research side and we have looked at it from the health side. But in my opinion, the progress will come from the intersection of the two. So we have to get better at turning research findings into improvement in care. And we have to look at care more from we have to capture the data and we have to learn to improve, which we're often not doing. So you cannot improve something you don't understand. So I believe the intersection between health and research is critical for us to move ahead. And it's already happening. So, I mean, I've met John. He's regularly at our meetings, now online, virtual, but we've met in person. And you could see that there is a beginning collaboration between the research parties and the health parties. And I wish that in 30 years, we can look back and say that was the year where we really got our act together and joined healthcare with the research part, and that we see the benefit in from today.
Mati, 30 years from now, what are we going to say changed?
I strongly believe that in 30 years from now, we will have learned from the COVID crisis what I said at the beginning. Cancer has no borders. And therefore, we have to realize that the idea that there is a prerogative of the states in health is not an excellent idea. It's an idea that needs to be changed, reformed, and we have to work together. And I believe this is a chance we have to capture right now. We have, I hope, learned this, and I hope this is now, and I hear very positive voices that this is now heard at the level of all ministers at the top level, not only the health ministers, but the whole ministries in all countries.
Thank you. And John, the health legacy here.
I think whatever we do on a cancer action plan will have a positive impact. I make that statement, which might seem a bit bold, but I really believe that whatever we do is going to be positive. The question is, how positive will it be? And that's why it's important to select the right initiatives at European Union level, which will trickle down and will involve the member states, involve citizens and patients in order to change the situation. We have to be realistic. If we come up with some global moonshot figure that won't be reflected in reality, then we lose credibility, I think, for ourselves and for our partners. So I'd really appreciate if we could have a reflection on this and come up with something that's going to be realistic. And the big problem which I see, which nobody has mentioned so far, in relation to coronavirus is the economic impact of coronavirus. What effect is this going to have on available resources at national level in the health systems? Are we going to have the health systems which we have today, or the health systems which we had 20 years ago? And that's something which I'd really like to have a discussion on at some stage, because it's not only the events which we've encountered over the last few weeks in terms of delays in treatment and so on, and hospitals being in difficult circumstances, but really looking forward, what is the economic challenge to maintain the level of services we already have, let alone the level of services we hope to have?
Thank you. Well, I think that's a great last point. And so thank you so much, panelists, for bearing with us here and for sharing your thoughts and for the important work that you're doing on the cancer plan and the cancer mission and treating cancer patients. Thanks again to our partner Bayer for helping us present this discussion. And Politico will host additional virtual events this week. So please check out our website for event updates. That's politico.eu/events/future-events. And thanks to our audience for watching today. Have a great evening. Good night.